We have a health alert tonight when it comes to preventing breast cancer.
A simple pill could lower your risk for the most common type. Our chief health editor, Dr. Parthanandi, joining us now with a closer look.
All right, Doc, what pill are we talking about here?
Yeah, Stephen, this is very interesting, especially to me because I've got multiple members in my family with breast cancer. So more than 57,000 women participating in the ongoing California research, the teacher study, reported their use of aspirin. Now, researchers found, Stephen, that taking baby aspirin at least 3 times a week had a 20% risk reduction for a common subtype of breast cancer known as hormone receptor positive or 2 negative. Overall, women taking low-dose aspirin regularly were linked to a 16% lower risk for breast cancer, which is great news.
So, Doc, how does aspirin help, and what dose are we talking about?
So, important question, Glenda. So, baby aspirin has anti-inflammatory effects, and this could play a role in preventing breast cancer. This study defined low-dose aspirin as 81 milligrams. Besides skin cancer, breast cancer is the most common cancer in women, and this cancer doesn't care your race or ethnicity. Over 250,000 new cases expected this year alone. So, if we can do something to prevent it, it'd be great.
All right, with that in mind, then, what's your prescription?
Stephen, so to lower your risk of breast cancer, number 1, avoid or limit alcohol to no more than 1 drink per day. The more you drink, the greater your risk. Also, watch your weight. Obesity and being overweight increases your risk, especially if you gain after menopause. Also, avoid being exposed to radiation like x-rays, CAT scans, PET scans, unless they're medically needed. Studies suggest links between this radiation exposure and breast cancer. And lastly, always do self-breast exams and get regular mammograms. Please, really important. Women between 50 and 74 years of age should get mammograms every 2 years. Women between 40 and 49 should talk to their doctor about when to get them and what their risk is.
So, Doc, there's been some kind of concern about taking aspirin every day. I mean, are we talking about regular aspirin as well?
Important question,
Okay.
Glenda. So researchers only found this link with low-dose aspirin, not regular dose aspirins or ibuprofen. So talk to your doctor because more research is needed, whether aspirin would be right for you.
Doctor, thanks.
Hey, my pleasure.
Thank you, Doc. And if you have a question or health concern for the good doctor, you can email him at drnandi@WXYZ.com or send it to us on Facebook or Twitter, and we'll get it right to him.